Dr Bryan Tan, Chief Health Officer at Salesforce for the ANZ Region. I work in the area of using technology to impact patient engagement in particular, and a whole bunch of other use cases to transform healthcare.
It's great to chat again, Brian. What brings you to HIC this time around?
Chairing a session yesterday, AI innovation, always come to HIC. I think this is like my 23rd. I don't know if it was called HIC back then. I remember the first one was in Hobart that I attended way back when, I think it was 2003. Somewhere around then. And yeah, so regular comer, regular supporter of the industry, obviously, and been in digital health for quite a while now. Yeah.
Amazing. And, Salesforce obviously continuing to have impact in healthcare. We're talking a lot here at HIC about patient centricity and engagement and artificial intelligence and resilience, cybersecurity and staff and all these topics. What's really aligning at the moment in terms of some of the key messages on the Salesforce side?
Yeah, so we've been spending the last year pretty busy on a number of areas of work across the health spectrum. I still joke Salesforce is the best kept secret in healthcare. And despite the fact that we're in tens of thousands of healthcare organizations, both here and globally, not many people know about us and our work in health. However, a lot of people are probably using Salesforce technology. So if you're using Slack, you're using Salesforce. If you're using MuleSoft, you're using Salesforce. Using Health Cloud, Not-for-Profit Cloud, Sustainability Cloud. There's a whole bunch of platforms there. Tableau. If you're using Tableau, you're using Salesforce as well. So we're in a lot of healthcare organizations, from federal down through to state, down through local providers. We're in aged care, disability, mental health, acute hospital sector, all the way through private clinics, so private and public as well. We're in pharmaceuticals. We're in clinical research organizations. We're also in med tech companies. We've had some really interesting developments over the last 12 months. We've announced some partnerships, for example, with Telstra Health, who are looking to build their next generation of products on Salesforce as well, in partnership with Snowflake. And we've gone live at a couple of our clients as well, especially in aged care, with all the urgency around the reforms that are going on and the 1st of November deadline. So we've been helping a lot of organizations in aged care scale up and have really good granular reporting capabilities for operational excellence, and also the requirements that are coming up. That's a deadline 1st November. We're happening at federal level across aged care, disability, obviously, as well, and a number of other areas. APRA, I'm a customer of APRA. APRA also uses us as their platform. So a lot of different federal, local organizations.
Yeah, absolutely. And so you're up on a stage later today, sharing a bit of a use case. Tell me about that.
I came up with a topic called From Computation to Conversation. I wish it was a bit catchier, but anyway, that was the best I could come up with.
The alliteration.
Yeah, a little bit, yeah. And essentially, we're going to be talking about some recent advancements and innovations and achievements in patient engagement. A lot of our healthcare organizations are thinking about patient engagement purely in terms of portal-only approaches. And so we've been able to capture some outcomes this year that are blowing existing experience out of the water and totally redefining patient engagement. So historically, if you whack on a portal for your patients, you probably expect about 10 to 15% adoption at best. And that's people logging into the system, actually using it. Some of those figures are sometimes inflated if you also include your staff in that number to log into their patient portals for staff purposes, for credentialing, vaccination certificates and things like that. But universally, the experience is around about 10 to 15%. Now, what we've been finding is that when you think about engagement from a person-centric point of view rather than from a system-centric point of view, and instead of just thinking of a single channel of a portal and then ticking the box on engagement, but you think instead about how a person communicates and all the different ways that a person wants to be engaged with a healthcare organization, then we're starting to talk about 80 to 95% response rates, blowing out of the water. So we've got a couple of salutary cases. For example, 9,000 patients who hadn't seen a doctor in 5 years. And it's a First Nations case, actually, and wanting to run a vaccination campaign. I mean, you think about all the public health campaigns that have been run, low response rates to general mailings. But when you take a person-centric approach to think about what are the moments that matter, what are the channels in which people want to be communicated with, we start to see 95% of those 9,000 patients respond. Now, 85% of them actually said they wanted a vaccine as well and booked an appointment. And the remainder said, no, I don't want a vaccine. But even and above that, there's 95% response rate, which is totally unheard of in public health campaigns. And that speaks to the quality of engagement that you get when you think beyond the portal. So that's part of the
I see what you mean about beyond the portal, because often within a health setting, it's almost like there's enough work to just get up the portal, and it's like, oh, thank goodness we've got patient engagement now. Like there's a way for a patient to access stuff, but as you say, you need to have communication and engagement at the right points in time that resonate and that drive like some kind of value and all of that. So that's
and you need an orchestration platform to make that easy, because as you say, there's a lot of project fatigue. You've just implemented an EMR, then on top of that you implement a bit of reporting and you whack on the portal and you go, job done, staff workflows, patient engagement, and then you got project fatigue. So I think part of our job with our healthcare organisations that we work with too is make it easy to be able to engage your patients in the right way. And we also do a bunch of consumer research with healthcare consumers, like 60,000 healthcare consumers around the world, 10% of them from Australia and New Zealand. And we find that what the outcome of having good engagement and good digital experiences is it actually builds trust between the patient and your organisation. Little things like not having to tell your story multiple times and having a TISO approach instead, tell your story once approach. Using the digital technology to facilitate that tell your story once approach from the patient's perspective. There are about actually 4 factors that we've uncovered from our research that lead to good digital experiences. One is ease of understanding what I need to do as a patient for any care management process or any follow-up process. The second is access. Is it easy to access the information when I'm looking for it? And the third is also a streamlined experience so that I'm not repeating myself. And then fourthly, it's transparency about if I do share any data, how are you using that data to care for me? Those kind of 4 contributors then lead to a person feeling like they've been treated as a person and not as a case number. And when you start treating people as people, what we're finding is that there is a mathematical correlate then with how much they feel they trust you. And they'll give your organization a higher rating. And we did further research on top of that. We suggested, what's the outcome of that when trust is also a factor? We found actually that there's an interesting correlation between trust and forgiveness. So God forbid a mistake happens in your hospital, you fail to follow up. A patient is actually more willing to forgive your organization even if they have that level of trust because they already know that you care for them as a person and not just a case number. So there's a level of benefits and outcomes that you're achieving far beyond even that basic level of trust as well. It's a lot of implications.
To build that reciprocity, and you've got all this human... Right. And when it comes down to it, it's the human element. If don't be a jerk, and then others won't be a jerk to you. So it's kind of like... and there's a lastly then... as the forward-facing nature of all of these conferences, artificial intelligence has come up a lot in conversations. What's your hot take on artificial intelligence in healthcare these days, and what Salesforce is doing in relation to AI?
So we're pushing the boundaries. We're moving beyond generative AI. We're going beyond co-pilots, and we're moving towards agentic AI, which means autonomous agents which are able to act on their own. Now, the concept used to be, hey, these AI agents are going to replace labor. I don't think that's the case in healthcare. I think the way AI agents are going to be deployed in healthcare on administrative use cases in the first tranche, maybe eventually on some clinical diagnostic stuff, but right now we're focusing on operational efficiency. God knows a lot of our healthcare organisations at the moment are facing budgetary pressures, fiscal pressures, so a drive towards efficiency is a major conversation point for most of the organisations that we work with as a primary reason for delving into AI. That and staff experience as well. And then consumer experience almost a third after that. But operational efficiency is a big driver. And I think there, in that regard, the use of AI agents is going to help with the automation of a lot of the engagement. It's going to decrease staff burden while at the same time increasing person centricity and people empowerment, because it's going to allow a lot more self-service. Think about trying to arrange an appointment with a clinic instead of calling up a number of different clinics in the healthcare organisation and trying to find an open slot. The agent's going to be able to find that kind of stuff for you, match the requirements of your particular appointment type with the skill sets of the clinicians or the people or the consultants that are going to meet that consultation. and be able to do a lot of that automatic matching and intelligent appointment management as well. So there's a lot of benefits there in operational efficiency. Then also think about how healthcare is moving away from a campus-based kind of model of care, which is highly expensive, predicated on old battlefield models back in the 1800s, 1900s, right? And that model, which was designed just to care for battlefield wounds and triage cases in that acute setting, is now being deployed over time to chronic disease management, which is a totally different problem statement, actually. It's not just an acute case. In fact, you want to get to patients before they get to that acute stage. So how then can we migrate thinking from institution campus-based care towards decentralized models of care? And how are we using technology to facilitate that real-time coordination, collaboration, and communication in a very different way from the systems that currently are available as well? So a lot of focus on human-centered design at the front end, the data models and configurability that we require in the back end, and also the middle layer of how interoperable are we with all the other systems that are going to be in play in an organization. So we work with organizations with anywhere from 90 to 900 different systems. There will always be an environment where there are multiple systems at play. There will never be a situation in healthcare where one system rules all, despite the marketing of some providers. I don't think the reality is that, at least not in our experience. And so we're always going to be a perfectly integrable system as well in that situation. Yeah. So Salesforce POV.